So there are some newer technologies coming out you may or may not have heard of. Topical oxygen delivery. Remember I told you about hyperbaric oxygens and how inconvenient it is? Well, the tanks that you go in for these treatments are also massively expensive and require a subspecialty type of a physician to manage it while you're in there, so it becomes a very expensive endeavor. Well, now there's newer ways to apply oxygen topically at a location where you need it. There are things called sodium octasulfate dressing, so a new specialized dressing to try to change that environment in a wound that is preventing healing. Placental-derived wound care products, so amniotic tissue-based things. These things are awesome. If you get a connective tissue matrix from amniotic tissue, you can actually improve the extracellular matrix of any connective tissue dramatically and improve it for the better. In the wound care world, you use amniotic tissue. Sometimes you lay it on the tissue, sometimes you inject it, sometimes you wrap it around things. We've been wrapping amniotic tissue around nerves and nerve surgery, gosh, for over 10, 15 years to reduce adhesions and help healing. So placental-derived wound care products are an important adjunct to this, but should not be the only thing that you use. Targeted antibiotics, can't emphasize it enough, or targeted antifungals. Molecular diagnostics are the best, I think. Things like platelet-rich plasma, that's when we draw your blood, we centrifuge it, and again, we can do this in my clinic. You separate the red cells out from the white cells, so you have concentrated platelets, which are the little structures that hold all the proteins and growth factors for healing. And then you just put that right on the wound or inject it around the wound. And that's been shown to dramatically reduce wound healing times. And then of course, deformity correction. You have to offload it. You can't have an ulcer with a high contact pressure, treat the ulcer and leave the high contact pressure. That makes absolutely no sense, but that is the standard of care right now at most wound centers.